I would say 20 years ago, when we had preschool kids that had difficulty learning to talk, that we viewed them as having a very transient problem. This is a problem of preschool. We'll get them intervention, they'll catch up, and they'll be fine. They'll never have another problem. We now recognize speech and language, primary speech and language impairments, as part of a lifelong disability. And so there's a large proportion of children who have difficulty learning to talk, who then go on to be classified as learning disabled, have difficulty learning to read. So I would say of all the kids with primary language impairment, probably 50 to 60% of them will have a reading disability, and the other 40% won't be classified as having a reading disability, but they won't have strong language skills, because reading draws on your language skills. Kids with only speech sound disorders, so kids that don't have a language impairment but only have speech sound disorders, they more often catch up and don't have, are not as likely to have academic difficulties, but we are now finding that in writing they seem to have difficulties in spelling throughout their lifetime, that's a big area of weakness. Socially, we have a lot of data to show that kids with language impairments and to a lesser extent kids with just speech impairments, but kids with language impairments, kids with speech and language impairments have difficulty in friendship circumstances as preschoolers, and then that can go on to continue to cause them a problem in school age. So there was some work done at the University of Kansas several years ago that in a preschool classroom, the children with language impairments, children with speech language impairments, the other kids did not seek them out as conversational partners. If the kids with speech language impairments were inclined to talk to someone, they more often sought out an adult to talk to than another child. And when they talked to someone, they got more responses from the adults than they did from the children, from other peers. And those same problems carry through into elementary school. So there's a study that looked at how children with language impairment join in play groups. And kids with language impairment have a huge difficulty joining in play groups. So in a 10-minute period, if like you and I were playing and a child with speech and language impairment came in here, that child with speech and language impairment would be have a much more difficult time gaining entry to our play than another child. And I think that the social difficulties that language impaired children have cause even greater anxiety for parents than the academic difficulties do, because the academic difficulties you can continue to work on, you can get that child help, you can hire a tutor. If your child has difficulty getting involved in friendship groups or having successful play dates, you can't hire a tutor for that, and so it's much more difficult. And if we think about ourselves, when we choose friends when we're in elementary school and we choose friends, we tend to choose those folks that are good at communicating. And so if you're not a good communicator, it takes you a longer time to say what you want to say. You don't use the right words, you have grammatical errors. People may not be inclined to seek you out as a friend. And in terms of like personally thinking long term, children with language impairments are less likely to finish high school, they're less likely to go to college, they are probably less likely to have great paying jobs because they've had academic difficulties, and that prevents them from later academic achievements. In terms of reporting themselves, adults with a history of language impairment do not report themselves to be less happy than other adults. So they are personally just as happy with where their lives are as somebody who has many more academic successes and vocational successes than they have.